So there will be a replay.
Remember, nice. Welcome, welcome.
Hi,
We're excited to
everyone.
have everyone on here to talk about things near and dear to our hearts. Hi, Abby.
Very much so. Hello. We've got some more people trickling in. I know there's a lot of people that are eager for the replay, so we are recording, but there's a lot of people that signed up, which is super cool. So I'll just give people a minute, whoever is going to join us live, to show up.
And thank you for joining us on 7:30 at night on a Wednesday. We're honored.
On a school night. Feel free to go camera on, camera off, whatever you're most comfortable with. I will ask everyone to stay on mute. Unless you do want to ask a question, and I am a big fan of making this conversational. So if there's a slide up and you're like, I have questions on that, I want to learn more, feel free to chime in and ask questions. If you would prefer to put them in the chat or save them for the end, totally fine. You can also send questions to me or Melissa directly. If you have a question that is a little bit more personal and you want it to be answered, we can ask it anonymously for you and answer it for the group so everyone gets the benefit of it. Some other disclaimers before we get started is Melissa and I are both professional, both practitioners in what we do, but we are not necessarily working one-on-one with you in this capacity. And so everything we're doing is educational. This is just to kind of give you some more ideas of directions you can go, information that you can take to improve your digestion, or if you decide you want to work, more closely with one of us, then this is a good way to get to know us as well. But please don't make big changes or do stuff without consulting your doctor for sure.
All right.
Okay. All right. I think that is everyone that is maybe going to join us live. So we can go ahead and get started.
All right, so I am Melissa. I am a pelvic floor PT and the owner of Wellest Integrative Health in Boston. We are very much a holistic pelvic floor clinic. We see anyone that has a pelvic floor, all genders. So anyone with urinary, bowel, sexual dysfunction, and reproductive dysfunctions.
And I'm Juliet. I'm a functional nutritionist. I work a lot with people who are struggling with their digestion, but we also know that digestive health is really central to inflammatory conditions, autoimmune, hormonal imbalances. So often people find me through that work as well. In my practice, I'll talk a little bit more at the end about functional labs and kind of other ways that we can kind of understand what is going on with your system, because just because you might be struggling with constipation or diarrhea or bloating doesn't mean that there is one specific solution for everyone that has constipation. There's usually a lot of different things going on. So I love to geek out and really figure out like what is going on for you specifically. And then I'm in Asheville. I met Melissa through being in the Boston area, and we are on a little hiatus in Asheville right now, but originally from the Boston area.
Okay, so diving right in. So what is the pelvic floor? So these are internal muscles that sit within your pelvis, and they are like a hammock. They're a bowl shape. They are responsible for maintaining continence, both urinary and fecal. They're internal muscles. So when they get tight or weak and they become dysfunctional, it's usually in the form of these urinary symptoms, bowel symptoms, sexual dysfunction, and reproductive. Usually these things, It's not like your neck where you're like, oh, I feel my tight neck. I got to go get a massage. These are things that you don't necessarily notice until you're having these little issues. So they're getting weaker and they're getting tense, more tense over time. And we don't necessarily know that we're tensing these muscles because they are internal. And when that happens, Juliet, next slide. The pubococcygeus is what we're going to focus on for this webinar, just because we're talking about digestive health. So if we're looking at this muscle here, you can see it attaches from, this is your tailbone. This is kind of like a bird's eye view down on somebody. Your tailbone here, the muscle attaches on the tailbone, and then it comes to the pubic bone. It wraps around the rectum. So when that muscle is really tight, it will kink off the rectum. So think of like a garden hose. When that gets kinked, the water can't pass through. It's the same thing. When this pubococcygeus muscle gets tight, it kinks off the rectum, and then it's hard for stool to pass through. So it's very rare that it's just this muscle that gets tight and weak and dysfunctional when it comes to digestive health and bowel health, but that's kind of the main culprit. So a lot of times this can, and it doesn't get tight just from like a trauma or an injury. It can get tight from many things, and especially for all of us that sit all day long and we kind of sit on our tailbones and everything's kind of tucked under us, these muscles get really tight. Next slide. All right. So pelvic floor dysfunction looks like many things. We often think of pelvic floor dysfunction as being like urinary leakage or incontinence, but it can be pain in the hips. A lot of times that can be a missed pelvic floor issue, low back pain. Pelvic floor tightness can refer into the back. It can refer into the groin area or the inner thighs. So making sure that you have a comprehensive plan when you have these issues, because a lot of times this can be overlooked. And it can be in the form of constipation or diarrhea, trouble emptying your bowels or bladder, pain with any sort of penetration or sexual function. For men, it can be erectile dysfunction, pain inserting a tampon, pain with a pelvic exam, and then urinary leakage or incontinence, of course.
And then digestively, so there's a lot of things that for me are clues into is digestion working well or not working well. So certainly any type of constipation. So if you're not pooping every single day, like healthy, well-formed, satisfying bowel movements, that's going to tell us that there might be a little bit of digestive dysfunction going on from a nutrition side of things. Bloating in the abdomen or like anywhere in the digestive tract. Some people notice really lower abdomen bloating, some people higher up, more in the stomach. Burping a lot after meals, gas pains or like sharp pains in the intestine can sometimes be trapped gas, which is not just like, oh, that's a gas pain, don't worry about it. It's like, okay, why is that happening? Reflux, heartburn, GERD, any sort of acid symptoms are telling me that there is some digestive dysfunction going on. Nausea, upset stomach, any sort of digestive symptoms after eating like hard to digest foods, fatty foods, animal protein. Those shouldn't be hard to digest foods, right? But if we have a compromised digestive system, they can pose a little bit more of a problem for us. And then, of course, diarrhea, right? Looser stools, urgency, or like bathroom emergencies, as Melissa said, right? Incontinence, or just like an urgent need to use the bathroom is going to tell us about digestive dysfunction as well. And a lot of those symptoms are very connected, right? So it might seem like, oh, well, I've got, this acid reflux happening, but it's actually very connected to your constipation or your bloating or other things that are happening kind of further down the digestive cascade or like the disassembly line, right? That your body does when it takes food and breaks it into nutrients. because the digestive system works from top to bottom. So each step needs to go according to plan. Otherwise, the rest of the process gets thrown off. So some sort of dysfunction happening really early in the process can definitely lead to symptoms in those later steps. So for example, right, being in a good rest and digest, like parasympathetic, meaning like very relaxed state, chewing a lot means we're going to get good stomach acid production. When we've got good stomach acid going, our enzymes, our digestive enzymes are triggered from our pancreas. That's going to tell our gallbladder to release bile. Bile is really important for digesting fatty foods if we're struggling with fats. And if we're struggling with constipation, there can be a biliary thing because bile is also our body's natural laxative. So if we are not producing enough bile or releasing it, that can be a constipation driver. Enzymes released in our small intestine. And then, right, all of these good things, the enzymes, the bile triggering that movement called peristalsis in our gut, and then moving things into the gut microbiome. So if we've chewed our food really well, we've broken it down chemically with stomach acid and with enzymes and with bile, by the time it gets to our gut microbiome, we're not going to get a whole lot of bloating maybe because things are really well broken down. But if things aren't broken down, maybe we're on acid reducing drugs or we didn't chew so well, we might get a lot more bloating. We might get constipation because these things earlier in the chain haven't really gone to plan. So I want to introduce you to this idea of our digestive tract being connected, right, top to bottom, and thinking about how all those different symptoms really can relate to each other. So constipation, as I mentioned, right, we're going to talk a little bit more about constipation tonight, but we welcome conversation on all topics of digestive health. So passing less than one bowel movement a day, as I mentioned, but constipation, right, we can also be pooping every day. And if they are hard, if they are lumpy, if they're like little rabbit poops, right, that can still be considered constipation. Maybe you're checking the box of pooping every day. If it's uncomfortable, it's not easy to pass. It's small, they're thin, right? Maybe we're having diarrhea every day. But if we're not completely evacuating our bowels, that can still be considered constipation. Similarly, right, straining, discomfort, incomplete or unsatisfying bowel movements all fit the description for constipation.
All right, and we, as a pelvic floor therapist, we love our Bristol stool chart. And if you've worked with us at Wellest, you've probably seen this before. But this is a really helpful just to figure out what type of stool you have and what consistency. So type 4 is considered normal. It's smooth, soft sausage or snake-like. Anything between 1 or 3 could be considered a pelvic floor dysfunction from muscle tension related issues, especially if you have a type 1. It could very much be that pubococcygeus muscle is like trying to relax but can't quite. And so stool's just kind of coming out, then it's getting sucked back in, coming out, getting sucked back in because that muscle is dysfunctional and tight. And then even something like a diarrhea or a type 6 or 7, that can create, if it's a long-term type of diarrhea, it can create pelvic floor issues because what's happening is the external anal sphincter or your anal sphincter is not getting the signal that your rectum is full of stool. And so the brain is kind of disassociated from those muscles. And so over time, if you're constantly having diarrhea, those muscles won't even know to like relax or contract to get poop out. And that can lead to a dysfunctional pelvic floor. So all of these are just important to know where you're at. And especially too, if you're thinking that you have a type 4, Just make sure it's not too thin, because even too thin of stool can be, again, that muscle is so tight, it's not able to soften and the rectum's not able to open. And so then you're getting that really thin ribbon-like stool. So that's from the mechanical standpoint. And then I'm sure Juliet has some points about the gut.
Yeah, definitely. I have a few slides coming up about fiber. We're going to talk about hydration, but typically, type 1, type 2, type 3, right? That's kind of like top half. We might be thinking about hydration. Dehydration can be a big factor with constipation. And also what type of fiber are you getting? And do you have enough water to support the fiber that you're eating? Very often, if we are eating fiber from whole foods like veggies and fruits, right? Those are also very have good water content. But if we're doing like a lot of fiber supplements and not drinking enough water to go with it, that can very quickly lead to constipation. So fiber is often recommended for constipation, but we want to make sure that we're hydrating properly. And then we're also going to talk about, if we've got really loose stools, what are some things that we can do with food? Very often fiber and, getting in, a little bit more fiber, maybe different types of fiber can be really helpful here. I want to pause for a second. There's a good question in the chat to go back to not fully emptying the bowels or having interrupted stool. So, like feeling like it was maybe incomplete and then, a little while later feeling like you need to go poop again. How can that be related to digestion and the pelvic floor? And then part 2 is that problems with peristalsis and what can be done? Do you want to start with that, Melissa?
Yeah, so if you're not completely emptying every day, that is impacting the pelvic floor because it's creating extra pressure within the abdomen and within the pelvic floor muscles. So that added pressure, that pelvic floor picks up on that and either gets really tight to a point where it gets weak, or it can create more like prolapse pressure types of symptoms. So it's definitely the pressure system that would cause the kind of dysfunctional pelvic floor. What about you, Juliet?
Yeah, I think as it relates to like peristalsis and digestion, I would be thinking about that like gut-brain connection that Melissa was referring to earlier. If our brain doesn't feel like it's safe to like fully relax and like, have a good full bowel movement. I think that can kind of lead to that, like kind of incomplete, okay, I'm, quick and then I got to get out the door quick and then I got to, like giving yourself enough time, working on, I think, gut brain connection, maybe looking into like vagus nerve support and getting better vagal tone. Vagus nerve is VAGUS, not like Las Vegas. Um, and so I would be thinking about like the vagus nerve. I would also be thinking about like the gut microbiome. So peristalsis, right? That like involuntary movement in our digestive tract can be influenced by our gut microbiome as well. Those little microbes are going to be signaling to our cells and to our muscles and the gut to move or not move. And so if things aren't kind of moving accordingly, then that might be something to think about as well as imbalances in the gut microbiome.
All right, so common issues we see with bowel dysfunction as a pelvic PT is definitely the chronic dehydration. Um, that's a big one, and Juliet will go into that a little bit more with her hydration tips. The poor toileting habits, so straining is a big one, and people just not knowing how to soften or relax their pelvic floor muscles when they are pushing. That's huge. A lot of people tense their abdominal area, and that actually contracts the pelvic floor muscles against stool coming out. And then toileting posture is a big one and easy to shift. avoiding using the bathroom when you need to, so that withholding pattern, tension in the abdomen. We hold a lot of tension in our abdominal area just as humans, and that can lead to tension within the pelvic floor. And then scar tissue restrictions is a huge one that we see. So previous pelvic or abdominal surgeries where there's just a lot of adhesion and scar tissue that creates restriction. And pelvic floor tension as well. Chronic stress too, just like Juliet was saying, that inability to get into that parasympathetic mode or that rest and digest state. And then with all of these, pelvic floor tension.
Yeah. There's a question about good toileting posture. I think we have that on a coming slide. So I'm going to pause on that, but we will get to it. So from the nutrition perspective, so things that I see, everything that Melissa has talked about, stress, hydration. I'm going to talk about that in a little bit because I want to add on the caveat of like add minerals to water. Meal hygiene. So like slowing down for meals, allowing your body to like fully enjoy what you're eating. We're not eating on the go. That's going to allow us to chew more thoroughly. We only have teeth in our mouth. We don't have teeth anywhere else. So like make sure they do their job when they have access to food. Other things that I see with the digestive stuff, whether that's constipation, whether that's diarrhea, acid issues, bloating, food sensitivities, and intolerances. So that is like a whole other webinar on its own, but like if you are reacting poorly to foods, that is something to think about. Nutrients. So do you have the adequate building blocks to build digestive enzymes? Do you have building blocks for stomach acid production? Like B1 and zinc, very important for stomach acid production. Do you have nutrients for liver and gallbladder health and bile flow or bile production? So we're kind of going back to like the most basic of basics, but like, are we eating a nutrient dense diet? Do you have everything you need for your body to carry out all of these functions? A lot of the times the answer might be not really, not quite. And then this is, again, another huge presentation all on its own, but imbalances in the gut microbiome, pathogens, parasites, overgrowths of other types, right? Even overgrowths of beneficial bacteria. We can have too much of a good thing. Whether that's happening in the stomach with something like H. pylori, or lower down in the gut microbiome in the large intestine.
All right, so how can pelvic floor therapy help with constipation and gut issues? So usually we want to figure out why this is happening and if there is a mechanical nature to the bowel issue. So first we'll review medical history, any medical conditions, surgeries, injuries, childbirth history, medications, what stage of life you're at as well, because hormones can contribute to all of that. Assess posture and mobility. So a lot of times our postural alignment, our pelvic alignment can contribute to the bowel dysfunction. We also will perform an internal pelvic floor assessment, either vaginally or rectally or both. Usually for a bowel issue, rectally is just the easiest way to assess the pubococcygeus and the coccyx specifically. And this really helps the internal piece. It's kind of like if you have a bowel dysfunction and you've gone to the GI or you've tried nutritional pieces, but you haven't had a pelvic floor evaluation, it's kind of like one of the things that everyone should get done so that you know, because a lot of times when we evaluate people's internal pelvic floor muscles and we ask them to bear down like they're having a bowel movement, they do what is called a paradoxical contraction, which is the opposite. They actually contract those muscles. So it really gives you a better sense of what's going on with the muscles and if you are pooping properly. And that's what we're all about. We want good poops.
Yes, I recommend going and just like checking that off most of my clients who have like chronic constipation is like, have you worked with or have you seen a pelvic floor PT? So that is, yes, completely agree there. There's a question in the chat about testing the microbiome. Yes. Welcome to the next slide, where we're going to talk a little bit about what that would look like. So from a functional nutrition perspective, the way that I'm thinking about it is by gathering a lot of information. So I'm looking at all sorts of symptoms beyond just digestive symptoms, but like food cravings. What do your fingernails look like? Do you sleep through the night? Like tons of different symptoms that you might not think are important or are related, but really are. Looking at a food journal, right? Looking at different patterns from your food journal and eating habits to symptoms that you're having, and then looking at patterns in functional labs. So in terms of microbiome testing, that would be in a GI panel. The one that I use is called the GI map, blood work, food sensitivity panel. So gathering a lot of information, right? As I said at the beginning, very rarely is it just like, all constipation needs, this one solution. It's like, okay, what is it specifically going to be for you and your body? And that's why I like to gather a lot of information. And then we have a really holistic approach to it of there might be some lifestyle stuff, right? It might be some, meal hygiene. There might be, some kind of like stress or nervous system support. Are we going to be making changes to your diet? Most likely, right? Kind of all based on what we're seeing in some of your labs and what we're seeing in your symptoms and your health history as well. And then we address what we find. So based on what we're seeing in labs, based on what we're seeing in your symptoms, we are often thinking about liver and gallbladder congestion because of how common or how important bile is for motility and regular bowel movements. So the gallbladder plays a big role. Digestive function, like stomach acid, digestive enzymes, addressing gut microbiome imbalances. So based on what we find in the GI map or the GI panel. So those are all going to be kind of like the important steps or like, all the different inputs to putting together a really good program for someone. How do you test for adequate stomach acid? It's a good question. There are conventional tests and scopes where they can like put things down your throat to like measure the pH. There are also some at-home tests that you can check out in terms of like drinking. Trying to think of what they are off the top of my head. Like a little bit of like apple cider vinegar to see if there's like a warming sensation in your stomach. If there's no warming sensation, then that might mean that there's not adequate stomach acid in there already. And baking soda. So baking soda is basic and stomach acid is acidic. And if you put them together, we would expect you to burp. And if you don't, if you drink a little baking soda in water and you drink that and you do not burp for, I think it's 5 minutes is the cutoff, then that might be a sign that there might be low stomach acid. Great questions. So tips to prevent constipation from a nutrition perspective. So veggies and fruit are really important. So making sure that you are getting enough fiber in your diet, more than 5 servings, right? Like 7, 8, 9 servings a day is a good place to aim. If you're only eating like 2 or 3 servings a day, right, going up to 7, 8, 9 right away might be uncomfortable. That might not feel good, but slowly working your way up. From a constipation perspective, fruits that are good, pears, kiwis, figs, banana, berries can all be good options. Lots of veggies as well. And then chia seeds, beans and legumes, oats or oat bran are also have good types of fiber. Increase fiber foods that make you feel good. So play around with what feels good. If broccoli and kale make you feel really bloated, don't go crazy with those, right? Focus on the types of veggies, the types of fruits that make you feel really good. Don't contribute to bloating and gas. my little note down here is that like if just looking at this bowl of kale is making you feel bloated and gassy, that might be a really good sign that there are some gut bug imbalances that are leading to constipation. So particularly methane producing bacteria are going to slow down digestion. And so there might be some overgrowths of some methane producers. That's a really good clinical clue to me about if certain foods don't work for you. That actually gives me a lot of information. I have this very wordy slide. I kind of put it together at the last minute because I'm like, oh, we're talking about, constipation and eating more fiber, and not all fiber is the same. So there might be some foods that are really helpful for you and some that really are a disservice to you. So two types of fiber, soluble fiber and insoluble fiber. Basically, what do they do in water? Do they dissolve or not? They are both good for digestion. They're both good for motility. They both can help with constipation depending on what type of constipation you have. So insoluble fiber is helpful to kind of like speed the passage of food through the digestive tract. It increases motility. And soluble fiber is helpful for bulking stool. So if you struggle with like really thin or small or loose or unsatisfying bowel movements, right, going back to that conversation about like interrupted stool or, kind of feeling like I have to poop a bunch, in a short period of time, pooping a few times a day is totally fine. If you're pooping like twice a day or you poop after every meal, like that's not something that I'm worried about. But if it's unsatisfying and it's like in quick succession, we might be thinking about a little bit more soluble fiber to help bulk and create like one kind of continuous bowel movement. And so then I have some food ideas in here as well in terms of foods that are going to be kind of leaning towards more soluble or leaning towards more insoluble fiber. No food is one or the other. They all have a combination. But if you are struggling with loose bowel movements, thin, incomplete, focus more on the soluble fiber foods. And if you're dealing with really slow motility, maybe focusing on the insoluble fiber could be helpful for you. Water and hydration. So make sure you are drinking at least 60 ounces of filtered water a day, likely more if you are sweating, if you're living somewhere dry. Winter can be really dry, summer for sweating. So like no time of year is exempt from drinking more water. If you're exercising, another good goal is half your body weight in ounces as a kind of minimum or a starting point. So 150-pound person aiming for 75 ounces of water. So we're drinking enough water. We also need to be adding minerals, especially if we're getting in good quality filtered water, which I highly recommend. We're drinking filtered water, adding in some trace mineral drops or a pinch of unrefined salt. We all need electrolytes. Electrolytes help transfer water across our cell membrane and actually get it into our body. So if we're drinking tons of water, we're peeing clear all day, we might still feel thirsty. We might still be having those like constipation looking poops where they're kind of like hard and pebbly because we're not kind of functionally or like comprehensively hydrating our cells and our colon. So getting in minerals, getting some trace mineral drops is going to be really important. Potassium is an important electrolyte, and magnesium is also very important and can be a great stopgap if you're struggling with constipation to bring in a little bit more magnesium as you're getting to the root of what is causing chronic constipation. And then a little bit more kind of lifestyle things. So eating breakfast first thing, I think if we're struggling with slow digestion, one of the things is like, I don't want to eat, maybe I'm feeling a little bit more bloated, maybe I'm not hungry, but it's still important to eat, especially first thing, because that's what wakes up our digestive tract. And if we can take advantage of when our bowels are most active, early in the morning, 6 to 8 a.m., if we can get up, if we can eat something, drink a glass of water and go out and move our body, that helps kind of kick off the digestive cascade. So our bowels are going to be more likely to be moving and active in that early time window. They're on a daily rhythm, just like our sleep-wake cycle. They are part of that same circadian rhythm. So they're going to be most active, not most activity, after meals, and when we wake up. So getting up, especially getting outside, sunlight is going to be really helpful to that circadian rhythm as well. Is there a certain brand of mineral drops? It's a good question. There's lots of different options. One that I use is Concentrace Trace Mineral Drops, but there are lots of different options out there, and they're all going to have different ratios, different combinations of minerals. So you can play around with like what works really well for you. Maybe one with higher sodium really works well for you, and that tastes really good. Our tongue gives us a lot of good information about what's good for our body. There might be one that's higher in magnesium or higher in potassium. So maybe playing around with some different versions can be helpful as well. Okay.
Question from Shayna about coffee first thing in the morning. From a pelvic floor perspective, not ideal. It would be great if you had like a glass of water before the coffee. You probably, Juliet, have some other thoughts on that as well, but just from being like both irritate, especially a bladder irritant, but also just irritating the gut initially, first thing in the morning.
Yeah, and irritating our adrenals first thing in the morning. So adrenal stress can be related to digestive dysfunction, because of that relationship with our nervous system. So if our, adrenals, if our stress response system is like really tanked, that can certainly influence our, digestion, our skin, our brain, our mood, our sleep. And coffee on an empty stomach first thing can be a little bit more taxing on our adrenals. It's going to increase our cortisol levels. It makes us feel awake, but it might be kind of artificially like mashing our foot down on the gas when our body's not really ready for that. So I definitely recommend having coffee with your breakfast. We don't need to give up our coffee. I love coffee. But making sure that we're kind of supporting that stress response that coffee gives us by kind of blunting it with food. If we are relying on coffee to have a bowel movement, then that is a really good clue that there might be something else going on.
All right, so the squatty potty. Now, you don't need to have a squatty potty at your house to have good toileting position. Just having your knees slightly elevated above the hips is helpful because, again, it relaxes instantly the pelvic floor muscles and it realigns the rectum so that it's more straight instead of kind of being in like this curved position. So this is an easy thing to integrate into your toileting position. Even for urinating, it's really good to completely empty the bladder. So you can either do some books or toilet paper to put your feet on. You don't need to have the actual squatty potty. It is nice because it kind of shifts underneath the toilet. And then we'll talk a little bit more about breathing during a bowel movement, but just to making sure that you are like your glutes are relaxed and your abdomen is relaxed before you start peeing or pooping. And then on the next slide, so a great tip is when we go to Valsalva, which we shouldn't necessarily be doing, but pushing to have a bowel movement, what tends to happen if you're thinking about how you poop right now or when you go to poop tomorrow or tonight, just check in. Is your belly kind of suctioning or pulling towards your back like you're putting on tight pants? Because if it is, that's actually contracting the pelvic floor muscles and not softening them or relaxing them. And that's what needs to happen to get stool out. The pelvic floor muscles need to widen and expand down into the toilet for you to get stool out properly. So the pushing can be improved with just a simple, if you try blowing through your mouth, almost like you're blowing through a straw, and you'll notice that your belly cannot possibly suction in when you do that. So that can really help just kind of reintegrate good breathing habits with pooping and peeing as well. And then just making sure too, like if this position is not helpful, you can slightly internally rotate your hips a little bit. And we kind of play around that at our practice if we need to do that. But if you turn your hips in a little bit or pigeon toe your feet, that opens up the pelvic floor even more, which seems kind of counterintuitive. It seems like you'd want to open your legs more, but if you can just like gently turn the feet in, that internal rotation widens the pelvic floor, especially around the external anal sphincter even more. And I think that's it on that slide. So then breathing is so important when it comes to overall health. Juliet was talking about vagus nerve and, you know, calming the nervous system, and so important for pelvic health. Just you know, over the years, we just get stressed. We breathe all up in our chest. We forget how to breathe into our belly. So if you try placing one hand on your chest and then one on your abdomen and taking a nice big belly breath, inhaling all the way down into the hand on your abdomen, your chest will come up a little bit, but it shouldn't be this big motion. It should really stay soft. And where you should feel the motion is down in your hand at your abdomen. You should feel your hand go out. And as you're inhaling and your hand is going out, your pelvic floor is softening or relaxing into your seat. So inhale into your nose, the belly is expanding and the pelvic floor is dropping into your seat. Think of sit bones widening or creating space around your sit bones, like you're passing gas or releasing urine. So tapping into this breathing, even like during a bowel movement, if you're having difficulty, checking in, taking some of these big breaths, even before you initiate pooping, sitting on the toilet, doing this breathing is really impactful and can make a huge difference if it is really a tension-related mechanical issue. And then a lot of people probably already do this or have heard of the self-abdominal massage, but this is also helpful to stimulate the gut motility or the mobility and the peristalsis. So, and also it's addressing abdominal tension. So if we're looking at one here, this is generally, if her hand is a little too far over to the side by the hip, but if we moved it a little closer towards the belly button, that area is the ileocecal valve. And that area is really important because it's where the small intestine turns into the large intestine. And for people that get bloating, the bloating happens in the small intestine, and that ileocecal valve gets dysfunctional from that bloating, and that bloat can't pass through, and that's where it gets kind of stuck in there. So I like to tell patients to really focus on that number one area, again, a little closer to the belly button, but sinking your hands down into the tissue so that your nail beds are turning white. You don't want to be just on skin going like this. That's not helpful. You want to sink down so you feel like you're kind of on a muscular layer. And then you're doing gentle circular motions, not big, just like this. And then you might even feel like a lot of patients will feel the gas kind of like disperse. And it feels really good. So you hang out there for like a minute and then you're following this clock all the way around. You're moving to the next part. So you might move up to almost, you know, a little before 2, doing the circular motions, stimulating things, moving on, and you're following that large intestine. As you get down to 3, a little bit lower, you're getting to the descending colon, and the idea is you're kind of getting blood flow and stimulating this. So once you've done those little circles around that clock, then you can keep your fingers kind of, pressing down into that muscular layer with a little bit of lotion. And then you can do one big circle from the right hip up to the left hip, really sinking in. And again, that's helping to kind of get the digestive tract, give it some blood flow, get things moving, and also helping with abdominal tension. And then taking some deep breaths after this with your hand on your chest and on your belly, thinking of the pelvic floor relaxation would be very nice. All right, so this is, if you haven't been to our office, I think a lot of you have, which is awesome. This is our nice big treatment room. We see people for 55-minute sessions. For someone with an issue with digestion, we like to see people weekly initially to get things moving in a good direction. Usually people will notice if it's helpful. Again, it depends on how long this has been going on for. If it's chronic, it will be much longer than 2 to 3 visits. But if it's something that you've noticed within the past year, you definitely will notice the ability to poop more easily and just more effectively.
And their office is so beautiful. I highly recommend if you're in the Boston area, go see them for sure. So in terms of how I'm working with clients, so I'm working one-on-one with clients in a 6-month program, which gives us enough time to, right, collect that information, make some good changes, and then create change that lasts rather than, something that's going to be super short term. So I do, kind of, I think 6 months is a great length of time to really initiate all of that. As I said, we start with a deep dive into the health history, looking at your symptoms. We're going to be looking at any labs. This is a screenshot from one of the labs that I run. This is the GI panel. This is not looking at the microbiome. That is a few other pages of the same test. This is actually looking at intestinal health markers. So we're looking at digestive function. Are you producing digestive enzymes? Are you breaking your fats down? What does liver detoxification looks like? That's what we're looking at with beta glucuronidase. What does your gut immune system look like? Is it really fired up? Is it because we're, eating gluten or other foods that don't make us feel good? That's what that anti-gliadin would be looking at. Is there inflammation in the colon? So that's what calprotectin is looking at. So that's kind of what we would start to gather is more data, more information. And then over that 6-month program, we're meeting regularly to check in on progress, to make adjustments, and to kind of work you through the 6-month program. 6-month program that I have, created based on your unique needs. Are these stool, blood, both? So this test, the GI map, is a stool kit. It's an at-home stool kit. Food sensitivities is a blood test. I look at comprehensive blood work as well. Also a blood test gives us good information on like liver function, your immune system, inflammation, thyroid, things like that. Very often, low thyroid, hypothyroidism can be a contributing factor for constipation as well. So thyroid support and checking in on those things can be good too.
All right. Any more questions for us? And here's our contact information. Feel free to email directly if you have anything that you want to ask further.
Yeah, Shayna, good question. So do I look at minerals and HTMA tests? Sometimes I use the HTMA with a few clients. I am based in, it doesn't say it here. I'm based in Asheville, North Carolina right now. But I see all of my clients virtually anyway, even when I was in Boston. So that's a good way to find me. Yeah, so mineral status, very important. We get some clues in terms of like looking at blood work and stuff. HTMA test I do use a little bit, and can be really important part of the picture as well. So yeah, that is a good question. Oh, good, Maria. Oh, I'm so glad you're here. And yes, I think the pelvic floor is such a beautiful combination with gut health and digestive work from kind of like the internal inside of things. So I'm glad you're diving into that. Thanks, guys. So great to have everyone here.
Thank you all. Have a good night,
Excellent.
everyone.
All right, so I'll be sending out a replay tomorrow. If you've been here, you might not need to rewatch it, but you'll be seeing an email from us with that link. All right, so great to see everyone. Have a good night.